Hi, Bladder Relief Group. It's Dr. McJunkin, and I am happy to be with you guys today. Hope you guys are having a good day. It's hump day. So today we are going to talk about nighttime urination. And we're going to talk about the hidden dangers of nighttime urination. And I can guarantee you that most people don't know these hidden dangers and don't know how dangerous nocturia is. And that's getting up at nighttime to go to the bathroom. And so generally, first I'll describe what's normal. So normal is getting up 0 times or 1 time per night to use the bathroom. If you're getting up 2 times, 3 times, 4 times, 5 times more, obviously that is very abnormal. But what you might not know is that it actually becomes extremely dangerous for people. And so today, in today's live stream, we're going to talk about 3 things. We're going to talk about dangers. And so hopefully I'll do a good job of kind of laying out what those various dangers are and why it's important to get treatment. We're going to talk about remedies. So I'm going to talk to you about some of the kind of natural remedies that I think are useful. Maybe we'll touch on prescription medications for having problems at nighttime sleeping and some of the risk of those. And then we'll do just a little bit of testimonies. If you guys have any questions or comments, jump right in, and I'd love to answer any of those for you. So first, let's jump right in and let's talk about the hidden dangers of nocturia. And this is one of the subjects we actually wrote a book on. But I'm going to jump right into these things. And just to give you guys just a little bit of background, I have been practicing medicine for 18 years now. And over the last year and a half, I've really just focused on people who have bladder problems, overactive bladder. And so we specialize in a procedure that helps those people. It's called sacral neuromodulation. We use a specific kind of device called axonics. There's 1,500 doctors in the world who use this technology, so I am certainly not the only doctor. Having said that, we're the #1 site in the world for this therapy, so we do more of this than anybody else. But along my path to getting here, one of the big problems that I had was trouble sleeping. And so, like many of you guys, one of the parts of my journey was when my daughter was young, she was diagnosed with type 1 diabetes, and that's where your body doesn't make its own insulin. And so thankfully we have technology where we can monitor her blood sugar. And so that my wife and I are able to keep her safe, which is fantastic. We're so thankful. That's like a miracle for us. But there were years and years where my wife and I would get up multiple times a night, not because I was going to the bathroom, but because little alerts and alarms were going off, or because I was checking on my daughter. And so we were giving her juice or whatever to keep her blood sugar higher. If you go real low, you can have a seizure and you can die from that condition. If you go real high, eventually that causes all sorts of problems, including nerve damage. So for years and years, we really, really struggled with keeping her under kind of better control as we learned about her body, as we helped to control what she would eat. She was 8 years old, so she wanted to eat mac and cheese and all the things that kids love. But after a while of not sleeping well, of waking up multiple times a night, I started to really, really suffer in my own physical health. And so now I'm going to get into why. And so this particular subject, sleeping, is very, very important to me because it has such a profound effect on your health. And so if you're not sleeping because of insomnia, if you're not sleeping because of a sick child, if you're not sleeping because your bladder's waking you up, all of those things have really, really profound health consequences, all of them being very, very negative. So let's jump into what those things are. So I kind of consider myself an expert in this subject because I've read all sorts of books and learned all sorts of things about optimizing your sleep. and then we'll talk specifically about remedies that can be beneficial for you. And maybe we'll do another live webinar on just sleep because it is so important. But let's talk about some of the risk of not sleeping well. So the first thing I will say is I saw a gentleman yesterday, and I saw a gentleman before that. Both of them told me the same thing. Hey, I'm waking up 5 or 6 times a night, but thankfully I'm able to get right back to sleep, so it really doesn't affect me that much. And I hear that time and time and time again, and on one hand I'm grateful, like, oh, that's great that you can get back to sleep. A lot of people can't when you get up to go to the bathroom. On the other hand, what they're telling me is actually not scientifically true, and I'll tell you why. So we have these sleep cycles that all of us go through, and they're 90-minute intervals, and it goes kind of like this. And when we start going to sleep, we start in light sleep, and then we drop down into deep sleep, and so it's light, and then it goes down REM sleep, which is kind of light sleep where your eyes are moving, and then deep sleep. And each one of those phases of sleep is actually really, really important. As we age, those different stages of sleep actually become the different aspects of restorative sleep become less and less for us. But one of the dangers of waking up frequently is you're not entering into deep restorative sleep as much as you need to. And it's only during deep restorative sleep that all these kind of special things start to happen. And so one of the big problems that people start to suffer with as we age, but also if you're not sleeping well, is memory problems. And our memories get consolidated actually in that rapid eye movement stage of sleep. And so that stage of sleep is very, very important, but deep sleep is very, very important. And this is kind of interesting. Most people don't know that, this part of it. But deep sleep, every night your brain kind of shrinks just a little bit, and the fluids that we have surrounding our brain and our spinal cord start to clean out all of the gunk that's accumulated. And so if you're not sleeping well, you're not entering into that REM sleep or that deep sleep, and so you're starting to have memory problems. Long term, what that looks like is there's a really increased risk of different kinds of dementia and Alzheimer's, because that's where our brain cleans itself out. So if you're not sleeping well, you're predisposed to those sorts of things. You'll also start to have trouble with thinking, concentrating, word finding. All of those things go hand in hand with not sleeping well and just the health of the brain. Restorative sleep is the only time we have in our entire lives where our brain actually cleans itself out and where our brain kind of takes care of itself. The other thing, and this has been pretty well studied, is mood changes. And so you've heard that before. The fastest way to make somebody go crazy is to deprive them of sleep. And so I see this time and time again, especially when I see a spouse come in with their loved one, and the person will say, "I'm waking up, several times a night to go to the bathroom, and I'm not quite myself." And the spouse will be like, "That's right, they're really irritable and they're upset, and they have a lower tolerance for the stress of the day." That's very, very common. There's also other conditions, including mood changes like depression, anxiety, and then even things like bipolar disease, where it can shift you into different stages of that. So sleeping well is one way that we can fend off anxiety, fend off depression, fend off, and give us basically the adaptable ability to deal with life. Other things is, obviously, if we're not thinking straight, it's more common for us to have accidents, whether that's car accidents, falls around the house, falling over an animal. All those kinds of things actually become quite dangerous for us, but become much, much more common if you're not sleeping well. The other thing is it weakens your immune system. So when you are exposed to the flu, COVID, whatever it is, your immune system's not working properly. And you can't fight off the junk that you're facing in your life. There's pretty good research that it increases your blood pressure, that it drastically increases your risk for diabetes. And so there's been some really cool, interesting studies looking at long international flights, And so one of the things that they found is in an international flight, let's say that I'm going from here to Phoenix to, let's say, Australia, a really long flight. I'm not going to sleep all that well during that flight, likely. If they do samples, and they've done this research study of my gut bacteria, they'll find that my gut bacteria, just in that one day of travel, has changed, and now I have the gut bacteria of somebody who actually has diabetes, even if I don't have diabetes. So if you keep that up, it predisposes you to that condition. And so gut bacteria is a really important thing for mental health, for diabetes, for all these other things, for being healthy. And so that's one of the things that it affects that we wouldn't think about. Cardiovascular disease is still the #1 killer in America. And a lot of that's predicated on high blood pressure, diabetes if you have that, cardiovascular disease itself, forming plaques inside vessels, not being active. All of those things actually have a really high correspondence with not sleeping well. Weight gain is another big one too, and that's what I found in myself. As I gained weight, I didn't have as much energy, I was more irritable, kind of all of these things, trouble thinking and concentrating, basically every single one of these things. Risk of heart disease, and then also we'll start to see poor balance. And again, this becomes very tricky for people. So if you're waking up in the middle of the night to go to the bathroom, and you are having some balance problems because it's nighttime, you're not seeing things, and you trip and fall, that becomes a huge reason that people die, and it's one of the #1 killers for older people. So those are the dangers. By no means is that a comprehensive list, but I want you to understand that not sleeping well actually affects every aspect of your life. So when I see somebody who says that they're not sleeping well, that they're waking up multiple times a night, or even if they tell me the opposite, I'm waking up a couple times a night, but I sleep really well. I'm always thinking of all of these things. And I know that if we can get them to deep restorative sleep, where they're waking up once per night or 0 times per night, their life will be absolutely changed. So that was the dangers. Now we're going to talk about the remedies, point number 2. So I always like to think about natural remedies that aren't necessarily medications. Melatonin has been very well researched. It is our sleep-wake hormone. It actually has a big part. It's a really strong antioxidant. So kind of like how you would think about vitamin C. So it has a big part in immunity. But melatonin is something that I think most people should be on. It's something that I certainly take at nighttime. And there's all kinds of research on higher doses of melatonin, and that being very supportive of restorative, deeper sleep. So even if you're waking up frequently at night, that's not going to stop you from waking up frequently, likely. But if you can get into deeper stages of sleep, at least your brain can start to clean itself out, and you'll start to get some of those benefits. So there's melatonin. High-dose melatonin is also used for people with cancer and other kind of immune system problems, because it's that immune system boosting hormone. So some of the common doses you'll see are 1 milligram, 3 milligrams, 5 milligrams. A lot of times people complain that they feel kind of foggy or fatigued kind of the next day. That's a temporary thing. So if you feel that, try it again the next day and see if you feel that. Most of the time your body gets used to that. So I personally take, kind of a higher dose of melatonin. So I take 60 milligrams a day. And that's kind of a cancer, I don't have cancer, but that's an antioxidant, a really supportive dose that I use for my body. You guys obviously get to make your own decisions on that. That is a circadian rhythm, light, night kind of hormone. The other one that I mentioned previously is vitamin D. That's more the light hormone, and our body makes that from being directly in the light. So there's a lot of research on what's called light therapy. And so that helps to balance our circadian rhythm. And so one of the things that's recommended, that's been really well researched, is whenever you wake up, go out and try and get some natural light. So go out and actually get in the sun, get some natural light. It does something to your eyes, it does something to your brain, and it actually helps to restore that kind of night-day balance. Vitamin D3 You can buy it mixed with K2, but that's a really great one to take as well. There are more advanced forms of light therapy, and so, in Arizona, in the wintertime, it's perfect because we can go outside and get that light. In the summertime, it's pretty hard, even if we get out early. I encourage you, if you can, to do that. But there are some light therapies, like red light therapy is becoming a popular choice for people. It's an indoor light, and there's all kinds of research on sleeping better with something like that. So that's something that I encourage as well. On the flip side of that, at nighttime, it's called sleep hygiene, but one of the things that you want to think about is less turning down the lights at your house, and then it's blue light. So our phones, the screens that they use create blue light, and so if you ever walk by somebody's house at night and the TV's on, you'll just see like a blue kind of glow. That's blue light. That blue light actually wakes us up. It's the kind of light that wakes us up, and red light, kind of like the sunset, is what puts us at ease. So one of the things that you want to do at nighttime, if you're on your phone, and I'll just show you on mine real quick, is I have the setting where it just goes straight to red. And so at nighttime, I'll put my phone on red, try and dim all the lights in my house, so I'm like preparing my body to sleep. And so in doing so, I would encourage you guys, not to watch TV, all those kinds of things. So it's called sleep hygiene. I can do a whole nother talk on that. Another supplement that I really encourage you, I encouraged you last time, but this calms down smooth muscles and calms down irritated nerves. Magnesium, fantastic. That's something that most people should be taking. 300 to 400 milligrams at nighttime is what most people will end up taking. And then the final thing I'll mention is the thing that I do, and this is the thing that becomes the most effective for most people that have bladder problems that are waking them up at night. And that, again, is called sacral neuromodulation. And it is such a wonderful therapy for a lot of reasons, but one of them is you can try it before you buy it and see if it works for you. And so that's a really wonderful thing. It's called a trial. But you get to try it out and see if it works for your body, see if it works for your symptoms, see if you love it. Very simple, very safe, easy to do. It's an X-ray guided procedure. We do it with light sedation, so it's kind of a painless kind of thing. But for most people, when they do that therapy, that, I don't want to say instantly, but really it calms down the bladder. And so it just relaxes the signals that are getting to the bladder and irritating it and waking you up all the time. And so now I'm going to talk about some of the kind of, I would say, testimonials, or just some of the stories that I get to see with people in relation to this. Okay, so I always like to poll kind of the most recent people that we just have kind of seen and taken care of. Okay, so here's a gentleman that we just treated. He's able now to hold it during the day, where he's going every 3 hours and not every 30 minutes. And then at nighttime, he's no longer waking up at all to go to the bathroom. So that is a huge one. And again, if his daytime stayed exactly the same, but his nighttime changed, his life would be completely changed. I'm telling you guys, it's like one of the best overall things that you can do for your health. It's like just focus on the basics. Let's see. They have a gentleman that I took care of not too long ago who's getting up 15 times a night, which, as you can imagine, would be kind of, the worst thing that I could imagine. With some of the changes that we, implemented, and with the therapy, he went to where he was waking up, I think it was 3 or 4 times a night, which, sounds bad to me because I don't get up usually at nighttime. But for him, that was like a miracle. And so for him, he's actually going to get some deep sleep in his life. Routinely, Nocturia, or nighttime urination, is one of the things that we always follow during people. Okay. And so some people, that's their only problem they have. I saw a gentleman yesterday. He goes all the time during the day. At nighttime, he sleeps the whole night. I think that would be a better problem than the other way around. I think waking up all the time at night would be worse for your overall health. But here's somebody else. no leaks or pads at all. Intervals improved. Not waking up at nighttime. Again, I'm not shooting for, I mean, we obviously are going to try and get 100% relief for people. Most people will get at least 75% relief of their symptoms, so that's kind of the average. But if we can get you where you're waking up once per night, that's considered normal. And for you, that would be a huge, huge benefit. I actually included an article that I thought was pretty good. It's on the National Institute of Health's website, and it has other sleep conditions too. A lot of people have sleep apnea, which is a terrible, terrible condition because it affects all these exact same things. You can look at that article, and it talks about all of the risks that I mentioned if you're interested in reading about that. I would love to hear some of your guys' comments. How has nighttime urination affected your quality of life? How much energy do you have if you're waking up several times a night? How irritable are you? Do you have other medical conditions like gaining weight? Like we talked about mental problems, some early, let's say, dementia, diabetes, high blood pressure. Do you have any of those other conditions that may be affected with this? I didn't talk about this, but we talked about cardiovascular disease. A lot of people just think about heart attacks, which is, one of the huge killers, obviously. Cardiovascular disease also includes strokes. And so if you are not sleeping well, that becomes a significant risk for you. And that also is one of the biggest killers. It goes in that same bucket as heart disease. And so my mother-in-law, she very, very healthy, very health conscious, ate organic, exercised, was thin. She was, in really remarkable shape. But her biggest problem is she had sleep problems. And that's one of the things that wanted me to learn all about this. But she had sleep problems. Unfortunately, she passed away a little over a year ago now. But she had a really big stroke. And so as I think back, I just, one of the things I always think is, could we have done something? She had some health provider. She lives in a different state. But could we have done something in relation to getting her to sleep better? That was a really big focus. And anyways, makes me sad to think about her. But I think about all of you guys and how something like this could help you guys. I think we're going to finish it there. And if you guys have any questions, comments, I'd love to hear them. Thank you guys so much for your time, and I pray that you have a great week. Bye-bye.